Everyone, thanks for joining us in our breakout room. I'm going to take the recording in progress as a sign that we can get started. I'm really excited to be with everyone today in this breakout room, and I want to take a moment to thank everyone who's spoken at the mini summit so far. There's been so much learning, and it's always great to see what else is happening in the community and to really learn from it. My name is Thana, and I'm with my colleague Sammy. And we're part of the data and evaluation team at Brown Bagging for Calgary's Kids. And we're here today to talk a little bit about impact, about evaluations. But before we really delve into impact through stories today, we wanted to honor Indigenous storytelling traditions that have long served as a way of carrying knowledge, preserving memory, strengthening relationships, and making sense of change across generations. And you'll see a lot of these themes come up in the different ways that we talk about impact and how we measure impact and how we tell our stories today. Today's workshop isn't really about evaluation or analysis. It's more of a conversation about building better stories and about how we move beyond reporting numbers into um, talking about change. So we're going to do that through first talking about why we're here, who we are, a little bit about brown bagging and us and kind of why we're talking about this. We're going to a little bit talk about what counts as impact and how we decide those stories. And then we'll share an example of from our family grocery card program at Brown Bagging and some of the questions that have emerged while we were trying to understand data and trying to tell these stories. And finally, we'll spend some time together working through a case of what to do and how to do when you don't have necessarily the full information or the numbers are hard, or how do we tell these stories in a more meaningful way. So first, why we're here and who we are. Um, I'm Thana El-Sallabi. I'm one of two data and evaluation coordinators. We're really lucky at Brown Bagging that there's two of us who are dedicated to this work of storytelling and understanding these stories of the impact of our work. I come from a background of history, if you believe it, but I studied international policy and international history for my master's, and I've always been interested in stories, how we gather them, and how we share them, and that's kind of helped me into collecting stories and working with families and working with communities to tell the stories of change that we do at Brown Bagging. Sammy, do you want to take a moment and introduce yourself as well?
Yeah, so I had a bit of what Thana was mentioning. I am the second data evaluation coordinator here, and we do a lot of the same level of work across different projects. And my background kind of focuses on like public health. So I had a master of public health where we focused a lot on nutrition and food insecurity, and that really drove a lot of the work that we do here, especially working with children as well.
For those of you who aren't very familiar with BB4CK or brown bagging, we've been supporting families and children in Calgary for more than 3 decades. Throughout that time, a lot of people have known us as a school lunch program, but our programming kind of goes beyond that. We have a summer camp programming, we have a family grocery card program, we have a volunteer program, and we really do try to understand questions of food insecurity affecting our community and affecting families through different interventions and through different ways. And Sammy and I work in kind of telling those stories about that work. So we take it beyond the numbers that you'll see on these screens to what is the actual changes and what's actually happening with the families and with everything that we're learning. So that leads to our question today of what counts as impact? You hear it from funders, what's the impact of this program? You hear it from so many different people whenever you're trying to design a program. Okay, what's impact? What's impact? I wanted to take a moment and ask everyone to kind of come up to answer that question as a group. So I'm going to ask everyone to answer this question on the chats if possible. And take a moment. I'd like you to think about your own work in your own organization and tell us about a moment that you knew that your work mattered. Not necessarily a metric or a report or a dashboard, but a moment and what happened. Think about what happened, who was involved, and what made it meaningful. So if everyone can take a couple of minutes and write in the chat, and we'll read out a few stories. And if you would like to share the story yourself, you can open your camera and we'll give you the opportunity to share the story yourself. We'll take a few minutes to write them in the chat. I see Jody has written hearing people laugh and connect with each other. While everyone writes, I'll share another story that kind of came in that I thought of just while doing this. That's very recent, actually, from end of year party that we had for volunteers and families and for our community as a whole. And a family had taken 2 hours on the bus to get to Boness Park, and they were like, it was worth it, and we would do it again because the kids had fun, they connected with community, and for me, it's things like that where it felt like, whoa, that really was because I'm not sure I would do 2 hours on a bus with my kids. Doesn't necessarily sound like something I would enjoy, but the fact that they felt like that was worth it and that they came and did all of that was really powerful for me. I'm seeing Jen has written, I helped some volunteers set up a community movie event by helping them sort out logistics of the event, and main coordinators wrote me a little thank you card. I felt like my heart grew 3 sizes that day. I love that. Erica wrote, every time a client shares, they feel more confident or have secured a meaningful opportunity. That to me translates as impact. Jessica wrote, when one community member felt more comfortable to share about her mental health challenges, which then allowed another community member unprompted to share about his mental health challenges. Anya wrote, seeing people show up and trying something that wasn't there before, seeing people's confidence grow. I love hearing these stories and I love seeing how across our different work and across the different ways that we show up at work, we experience impact in such different ways. And one thing that's really fascinating to me is just how it really shows up. I'm seeing Chantal has written, I'm thinking about when I was working with the YYC Food Collaborative and our initiative to learn and advocate together for the groceries and essentials benefit, which ended up being passed thanks to the many mobilizing around the learning. Wow, that's really powerful and that's huge. All of them are huge, but that really does like sit with you and that must have taken a long time to get that kind of work passed. So across these different stories, so if you can go to the next slide, um, what we hear aren't stories of attendance scores or survey scores or percentages or outputs. They're not the things that necessarily a funder will ask for or things like that. What we're seeing is relationships, experiences. We're seeing changes that are based in human connection and as evaluators and as people working to tell these stories, it's really important to know that we often recognize impact through stories way before it's recognized in numbers or reports. And our job as evaluators is really to understand the ways that we do that. So now into a more like scientific way of understanding impact and trying to kind of understand these two elements of impact together. One, as having worked in the evaluation space for a couple years now, I love the OECD definition of impact. And the OECD is the Organization for Economic Cooperation and Development. Um, and the definition of impact is really a change that happens. So the broader and long-term changes that are positive or negative, intended or unintended, that result from a program, service, or intervention. And this really means what's the impact that has happened. The impact is what is a difference or a change that's happened that has happened because of an intervention, because of a program, because of benches or a walking group from the earlier group they were talking what's a specific thing that has made the intervention. And really, what we're trying to understand is we're trying to tell stories around relationships, stability, well-being, belonging, growth, connection, and these are the things that are harder to measure necessarily by numbers. But that doesn't mean that the evidence to do so it doesn't exist, and that doesn't mean that we shouldn't try to showcase how important it is to tell these stories. And that's part of the reason that we're here today. What people, next slide, sorry, thank you. What people often think, and I think there's a huge myth amongst nonprofit organization, is that we don't have enough data. Oh, we don't have enough data to tell the story. We don't have enough data for reports or for funders. But I like to challenge that a little bit, and I don't think it's necessarily a lack of data, but really a lack of the tools to tell the story that we're trying to tell. So what people think of when they think of data, they're thinking of participation numbers, survey scores, number of activities, specific things regarding service delivery. So they're really things that you can like check on a box rather than things that tell a story. And the way that we can kind of create stories that are based in data that are also really wholesome and tell the whole story is through telling the experiences into data and understanding. And we can do that through trying to measure and understand things like trust, belonging, stress, quality of life, dignity, quality of service. These are the stories that we're actually interested in telling. And these are the things that brought us to work in the nonprofit space. We didn't come to talk about survey scores, not necessarily. I geek out on survey scores, so I do like them sometimes, but I'm sure it's not what is the biggest drawing factor for most people coming into the nonprofit space. It's really how do we tell these stories about these things that we're trying to learn um, using things other than these traditional things that just we're told, okay, how many people attended X amount of events or something like that. And
So
so
we
when we're going beyond the numbers, I'm going to pass it off to Sammy to give an exact example because I spoke a lot about ideas. Sammy's going to give a concrete example of how do we do that and how we tried to do that at brown bagging.
Yeah, and we really want to dive into one of the programs that we continue to run at the organization and how we've tried to take an experience of just taking numbers and deriving actual meaning, not just from our perspectives, but perspectives of the families who participate in the program as well. So as Thana mentioned early on in the presentation, one of the programs that we run is the Family Grocery Card Program, Moving Forward Together, which is an initiative that's primarily involving reducing food insecurity and stress through providing grocery cards to families in the program, but also opportunities for them to meaningfully engage with one another to derive natural supports and wraparound supports throughout their program. So when the program is over, when the receiving grocery cards is no longer there, there's able to maintain those connections that they had. Program logic model is, for example, like reduce food insecurity or reduce perceived stress or increase sense of community and increase access to appropriate foods. And typically, when you talk about an evaluation model, we look at this, and this is what we've done in the program as well, is let's look at surveys and let's do focus groups, engagement activities, and partner with the University of Calgary, which you've done as well, to try understanding if we're actually reaching these outcomes. And this is important because we have a theory of change. So what we thought would happen in this program and when we designed it was that when families begin receiving the cards and they first enter the program, we would hopefully see a reduction in food insecurity or an increase in food security, which would reduce their perceived stress. And then throughout these community engagements happening throughout the program monthly, they would increase their social connection and their development of natural support, which would help them ease into no longer receiving the cards and have a wraparound support of other families and let people with lived experience to help them navigate when there's no more cards left, but they can still be a part of the program even when they're no longer receiving the cards as well. What ended up happening was a bit of a sorry, was a bit of a divergence from the initial method, but still kind of to the same goal. What we ended up finding was from those evaluation and looking at the surveys and looking at the focus groups, which we did see an increase in food security after receiving the cards. And the monthly community conversations were still being attended. But we did find from the surveys that, for example, that families were not mentioning that there was a significant increase in their social connections or in their development of natural supports. It was happening for certain families for sure, but not for the entire cohort as altogether. And different families had different perspectives of why. But for us as an organization, we was a more of a pivot to engaging the family engagement coordinator to help navigate, to help discuss with families as well and form those connections with them, which helped them gain access to natural support and other resources as well. And even though they were no longer receiving the cards, they were still a part of the program, and we still saw increases in food security even when cards were no longer there because of the support that they had throughout the program. But what we did notice is it just kind of diverged away from our initial theory of change that we saw that not, for example, every family is able or necessarily even might want to form connections. And this is what we call in the public health sphere an influence diagram. So I am going to test on this specifically and all the arrows and all the boxes. It's all very important information. But the primary thing of this is so like what kind of goes into this? Like we did see, for example, a reduction in food insecurity, but stress didn't really change significantly through our metrics of doing an evaluation. But that's also because stress is a very big issue. Like as we can see from this, like this is some things I could think of that we even like just heard from families and in the program, and like there's so many things of transportation or physical mobility or physical health or child health. And each of these things also related to each other. And something like brown bag, we can accomplish a lot of things, but I don't think we're going to open up the Strait of Hormuz anytime to increase or decrease gas prices. So we can focus on what we can actually address here. And for us, that was how can we, for example, focus on reducing stress, not through necessarily only grocery cards, but through those natural support and sense of community in the program as well. So we talked to the experts, which is not us, because we just saw the data. We just saw the fact that like stress this did not change, but we can't necessarily explain why stress is not changing for families in the program once they're receiving cards. So this is brings us into our method of doing a meaning making workshop, which is an evidence-based method where we actually spoke to families and presented the data to them and allowed them to kind of interpret the data for us. So typically we're talking about in like a scientific journal model, for example, is this would kind of be like the discussion section where we have the results and then we look at the research papers and we try forming a story. But we didn't really want that here because the families weren't experiencing what happened. And we wanted them to tell a story of what the data that we saw. The problem with that is not all this data is always very digestible. So this is how we reported the data that we found as one of our outcomes in the actual report that you can find on our website under the report section, which goes over how sense of community of families in this program changed the more they attended these community conversations monthly. And as you can see, is at the start of the program, there's no significant difference in their sense of community. But by the time they're about to no longer receive cards, the people who attended over 3 sessions had a significantly greater sense of community score. But the problem with this graph is that it's not very user-friendly because there's so much going on. The first of which is how do you explain sense of community scores? As someone who's doing the surveys, well, I know that we use a validated metric that we calculate scores for, but not every family is going to understand what that means. Secondly, there's a long timeline. You have to follow this data among different groups around from a 9 month period, which can be very hard to follow for people. There's also a legend. So you have different colors for different types of groups. Again, it's going to make it very hard to explain this for families in the program. There's intersecting lines, which in the math field can mean a bunch of different things, but that might also be complicated to explain. It's hard to compare values because you have to keep looking back to the scale. Overall, this is not a very user-friendly way of showing what happened. But what we're really interested in finding is this June section. When we see, for example, that families who attended more sessions had a greater sense of community, and that's something that we were trying to build in the program. We want to know, for example, what was it about that helped them? Did they resonate with this? Did they find that they were better able to get natural support and help themselves and their families after meeting others in the program? And what type of things could we do better in later iterations of the program as well? So when we actually report this and made it presented to families, we did change some things. First of which, we only focused on June because the rest of the months don't really matter to us right now. We just care about what happened at the very end of the program. We changed the scale. So instead of it just being like a line graph, we tried to making it more of a bar graph where you can actually visually see differences. So now a significant increased score of 27 looks visually more distinct than just like points on a graph, where someone might have difficulty following that. We decided to move the legend, just focusing on one data point at one time makes it simplified for people. And we also just laid out the scores as well, so they would not have to actually like go back into the graph. And this is a method for them to, for example, to see the data and for them to digest it and resonate with them. For example, like if they were someone who attended a community conversation, how did their experience reflect in the data? And that helps us when we're explaining it in our presentations or in our reports as well. So this is a bit of like some pictures of the actual event itself. So we obviously had food. You can't have an event without the food there. And actually, families were also reimbursed for their time as well. So we had payments for them, kind of like you would do like a focus group, similar kind of model as well. And we had different stations and like data actually laid out physically, and we were there with them in the room. And they can ask questions and point to different things. And this is how we kind of learn from their perspectives. And some of them are a bit more engaging too, where they can even write down things and put them on a board and articulate the way they felt about certain data that they saw. And what we took from all this is something called the collective discourse, where instead of just like taking all these quotes and doing a thematic analysis and being like, oh, all these quotes emerge and they come up with all these themes, that's not very digestible for people. So a collective discourse is a method that's again taken from the evidence and from literature, where you thematically group different quotes together that fall under the same category that tell a narrative. So we want the families who took part in this meaning making workshop to be a part of that story, for them to explain their collective voice about the data that they saw. So this is one snippet that we took from that same data that we talked about sense of community. And the sections you see in yellow are all the collective voice. So that's direct quotes from the families that we combined together. And then we also put in our own voice in white just to bring the narrative together to tell the story. So if you kind of see like the through line here of where we came from is we had an initial graph that we described in our report. But that graph is missing a lot of context. So then we started simplifying the graph to make it more user friendly in that knowledge mobilization piece. And then we took the quotes from the families for them to tell the story of how they interpreted the data that they saw. So what we heard from families from this specific section of the meaning making workshop is, I know everybody else here, and I know how important it is having that help from FGC or the Family Grocery Card Program. Even though sometimes I cannot remember their names, but their faces are more familiar. It can be hard to know people deeply if I don't know where you can make it to meet. If there are more such kind of sessions or programs where we'll be meeting again, more connections is also different for people too. Personally, I always approach people and I'm always starting the conversations. That's why it's not hard for me. So for us taking this type of perspective, we learned a lot of things about sense of community and about our ways we can help reduce stress, for example, through this program is the method that we're doing these community conversations can look different. If, for example, families only have one connection point in the month, maybe we start looking at different ways they can connect with one another. And also meeting people where they're at. If some people are more reserved, for example, we can look at different methods where they can, for example, passively engage. And we talked about the family engagement coordinator being more involved, for example, in natural support is they were now responsible for making a monthly newsletter where families can then passively learn about things going on in the program and outside the program to help make those connections as well. And here's a bit of the act. We actually made this into an actual zine. It's actually on our website, also posted the actual full PDF of it if you are interested in looking at it. But we kind of looked into like we took some pictures and we kind of described the whole process. And all of that you saw, we kind of put like as like a two-page spread where you can look into it as well to see all the information of how we took that complex data and tried to making it more digestible for people in the program. But we still have a lot of things to learn because not everything went swimmingly. Attendance for the event was a bit limited. We only had around 14% of the cohort actually attend. And as you know from like the data perspective, like that's not necessarily generalizable to everyone in the program, but this is very focused on people who did attend. Some participants still struggled to understand some of the graphs and connect them to the surveys that they were doing throughout the program as well, which did lead to some difficulty where like they were not essentially understanding if a percentage was high, if that was a good thing or a bad thing. Difficult to balance multiple perspectives. So as we said, we did that collective discourse method, but some people might have said different things. So then how do we incorporate those different perspectives into telling that narrative? And that was something we had to go a lot back and forth on. We were deriving these collective discourse stories. And then families, one of our goals actually doing this thing was families to directly contribute to the zine itself. But because of the time and time constraints that we have, they were not able to do that, unfortunately. So like a lot of the design came from us, even though the voices and the perspectives came from them. But overall, like we understand that not all the issues can be solved by us. This whole idea of doing this meeting making perspective was how do we just let families be more actionable in terms of data? They were the ones we were collecting data from them, and how they can take more stewardship and control over that data, and how their story is told to other people as well. And I'm going to pass it back to Thana to go a bit more of examples as a team.
Yeah. So as if you've been following along, kind of the way we've designed this workshop and like the mini conversation, the mini summit was, we always like to think of the work in a middle, like a funnel type of way of thinking about it. At first, we're talking about broad concepts. Then we got into a very specific example of we had data that we didn't necessarily understand and we didn't necessarily know what to do with. And then we talked to the experts. And I really do want to emphasize one thing from this conversation also is treating people's expertise as something that needs to be paid for their time. And that's something that's so important because we're flipping the conversation about who the expert is in the conversation and who we're learning from. And I think It's always really important when we're talking about evaluation, when we're talking about impact, especially also thinking about what Chantal was talking about earlier today and like decolonizing our ways of learning. This is a prime example of decolonizing our ways of learning. And when we bring back data that we collected from people, we're not saying, ha, this is what happened. We're actually saying, so this is what the data is telling us. Is this an example? Is this accurate of what you felt? Or is it something? Can you tell us more and fill in the story? And that example of collective voice that Sammy was talking about is a really good example of, and a really good way to like tell that story. And we find it also is really fascinating when you're engaging with folks and trying to understand their story because sometimes we understand things but from the data really differently than how they experience them. And even from a scientific perspective, a lot of people sometimes say, well, we'll just do qualitative data. It doesn't need to be that scientific. Actually, this is a form of scientific qualitative data, and it's a form of validating your data as well. When you say, this is what we learned, and you go talk back to the experts who are the people, and they say, actually, even though that's what's reported in the surveys or and the different things that we've done, that's not what we felt. That says something about the validation. So it's always fascinating for me to be in these spaces because I'm like, how can we decolonize how we gain knowledge? And this is what we were talking about earlier as well of like trying to learn from indigenous ways of learning because there's a lot of ways that we can decolonize how we learn and how we tell the story. And so we wanted to take a mini exercise together to do something called the missing context challenge. So again, I want people to be engaged if that's possible on the chat or to turn on your camera and talk to us if you'd like to as well. Uh, we wanted to kind of, if you were in our position and you got this data of the perceived stress amongst the cohort isn't really changing across 6 months. There's some slight changes between low stress at the 3 month mark. There's a little bit of a decrease in high stress, but overall, we're not seeing any changes. What would you do in the next 5 minutes if you can either type it out or turn on your camera and share with us? What is a way that you would use to deepen your understanding and fulfill that story? One of and this is an idea of also sharing ideas that we've used that you can use in different organizations. One of the things is this something that you want to talk about in a community conversation and bring it to the community and have them respond? Is this something you want to do a dedicated focus group to just understand this one thing for? Is this something that you take to a peer advisory council where you have the folks who this data is about really have this discussion, and these are peers within the cohort who are leading this conversation? Or are there any other ideas that you would take from your own experience in the different organizations that you were from? I'd love to hear any ideas that you guys might have, and um, if anyone can, we'll take a few minutes for folks to type in into the chat or turn on your camera, and we're here to listen. I'm seeing Jen has written, I would start with a community conversation about what the stress was about and why it wasn't changing. I like that. I think that's a really good way also of like understanding what is causing the stress. So here we're saying stress, stress, stress. We saw Sammy's, I call it the scary chart because I'm like, all these things really do add to my stress. It is quite scary just to see all those things together. But to understand what is the main cause of the stress for folks. I see Vanessa has written, she agrees, also a community conversation and followed by a focus group. Focus groups, I'll say, are really good when it's a small group of people to like really go deep into an issue. I think community conversations are great for gathering like the overall consensus or the overall direction of where things are, but or even to like talk about the conversation at a broader level, whereas a focus group is really good to go deep and delve into the specific issues.
I would
Especially
like
because they also
to.
tend to be paid. Sammy, sorry.
I just want to see like this is a bit of a challenge then. So let's say we are doing a community conversation or a focus group. How would you present the data about stress to the group? Would you kind of stick to this like bar graph that we have like in the report, for example, or what would be a method that you would want to articulate findings relating to stress to a group, for example, like maybe they're having issues with English literacy, for example, and you have a translator with you, or something where it has conflicts with like numbers. How would you kind of translate that knowledge into a broad group of people.
I'm seeing Jen also wrote, I would also determine why lowering stress was important in the goal of my work. Is it necessary thing to show reduction in stress levels? It's actually a conversation we've had a few times. And it's for us, for this example, it was related to our theory of change. So it was tied to our outcomes. And that's something that's really important, actually. And I want to emphasize when we're talking about evaluation is we don't necessarily want to evaluate for the sake of evaluating, but rather we would like to evaluate the things that are tied to our outcomes. Because also getting a lot of data from folks all the time can be really taxing and exhausting on them because they've probably told these stories multiple times to multiple people. So it becomes almost re-traumatizing in the way of having to retell the story. So it's really important early on in a program to determine what are we trying to measure and why, and how is it related to our theory of change? Is this something we need to learn or not? So I think, Jen, your question of like, why is stress something that we're measuring? That's such an important conversation to have within this conversation of measurement and impact. And are we just collecting things because we just need a lot of data? I don't want to be an AI machine, so I'm happy not to collect too much data. Jody has written, and ensuring the stressors and hypothetical stressors have been mitigated for the session. So providing interpretation, childcare, food, etc. Yeah, that's really important. That's something that's definitely we learn more and more as we try. Having that space for childcare, having that the interpreter, having the right interpreter also, who's not going to make the situation worse. It's so important so that what even when people are talking about these conversations, it's in a space where they feel safe to do so. I see Chantal has written hosting a sense-making session, a conversation, and deepening understanding with an output so it feels purposeful. Yeah, I think the so it feels purposeful thing is so important for people as well. Because again, they're taking time out of their days. They have really busy schedules. And like I said earlier, that family with a 2 hour bus ride to come to an event, like you want to make sure that people's time is respected and it's purposeful and that they feel like they're really adding to something. So it's really important to share all of that beforehand, early at the beginning, and to ensure that it's remains obvious to folks throughout.
And there's the bit about that as well as also the impact of the families being in that position. Because when you reframe it as they're an expert and you're almost kind of like asking for their consultancy for it, it does a lot to their like well-being, for example. Or like you're it's a matter of like what Thana was talking about before, like switching the like reversing the table on the power dynamic there. And that it adds to an element of like dignity where it's like you're not just gonna take the data and present it, but like you're asking me. And then so many families when we're actually doing it really just appreciate us being able to talk. Because sometimes they were doing these surveys monthly and no one knew from their perspective where they're going. And for our end, we knew that they were going to our database and making reports about them that get on our website, but a lot of them don't know that. So for them to be like, oh, this is what happened to the surveys, they're being articulate like this, even if they don't contribute their voice to it, just seeing in front of their faces just made a huge difference. And it's something that, like, even if you're not doing a meaning making workshop, but just having articulated ways of presenting data for people in like an approachable manner, it gives a huge difference in the way that they're going to interact with it in the future.
Thank you everyone who's shared on the chat and for this conversation. Again, this has been such an important part of our work is sometimes intentionally, sometimes unintentionally, but when you bring in people to the conversation, you really tend to decolonize the way that knowledge is created, and it's really powerful. And I'll let Sammy talk a little bit to kind of
Yeah,
wrap
so
us up.
kind of bring everything we've kind of like the funnel, we're at the very tip of the funnel right now, is just we want to go over like a quick summary, like everything that we've kind of talked about from traditional evaluation methods and what we've kind of accomplished or tried to accomplish, I would say, with the meaning making thing. Where typical and a typical approach to evaluation often is ends the data is analyzed, you make a report, you publish it, you give it to some funders, and job is done, move on to the next project. But for a meaning making, the approach begins by bringing people together to interpret the findings and then explore different perspectives and then share that into understanding. So instead of us interpreting the way the data was done and the data was collected and the findings that we saw, we're now putting I'm gonna say the onus, but also like their responsibility and their experiences into it as well. So the traditional approach is we collect that data and we analyze it and we report. This is very much also like the scientific model. And a lot we're saying that also applies to the scientific model too. When we talk about indigenous research, for example, idea of data stewardship, how is that data being taken and who is it being taken from and how is it being stored and who owns that data is a very important conversation too. And we also want to remove those types of things and we'll continue trying to do that as well. And from our meaning making approach, we supplement those with different things. So we collect the data, but we also ask for the community interpretation with the two instead of our own interpretation only. And when we analyze, we just analyze it for the donors and for the funders and for the website, but also analyze it from a way of making it seem more broad and for the general public, so anyone can understand and benefit from the information that we gain from the analysis from the actual data and perspectives of families as well, as you saw in the collective discourse. And then also right before we report on the data, we learn from it. We try applying our changes so it does not just stay in a void and no one sees what we learned. And we try applying it to our programs. We report and then we share it back to everyone, not just the highest tier of people who are receiving reports, but understanding our audience of like who needs to hear this and working to make that data approachable from all levels of information taking. So I think that kind of brings the end of the presentation. If we have any questions, we're going to be here. And thank you all so much for coming and attending.
We do have a few more minutes for questions if anyone does have uh, any questions. And one thing that is really useful, especially anyone in the evaluation space, I highly recommend getting an OCAP training. OCAP is an Indigenous way of learning and handling data. So ownership control, it's A&P. I'm blanking on the A&P. Sorry. Um, accessibility, but it's a way of dealing with data that whenever it has a lot of learnings that can be applied not just for Indigenous populations, but all across. And I think honestly, from my experience, I'm new to Canada, new-ish. It's like my sixth year here. Whenever I learn in a new way of Indigenous learning, I'm always fascinated and blown away by the power and the way things are done. So I highly recommend taking or looking into OCAP and seeing if it's something that your organization can allow you to study. And I think I will share a link to it as well.
I have a question. So a lot of the time when we're reporting back, the qualitative is kind of centered in storytelling and like only storytelling. Um, and I know you highlighted some different ways here, but outside of storytelling, what is the best way to report back to funders or to community? Um, it seems like it's the catchiest thing to do, or like the central way to report back. Um, so yeah, are there like other methodologies that you think are really useful or as easily translated to varieties of different audiences?
So that's a great question that I have a lot of thoughts on. But I wish there was like an easy answer of like this is the right way to do qualitative research and this is the end all be all. But I do think it definitely is like a case by case situation where it depends on the program, it depends on what you're trying to achieve, and it depends on who you're reporting to. Because I also do believe different audiences require different forms of reporting as well, and different like telling different parts of the story. Um, I think there is something in looking into like participatory approaches when you're dealing with community directly, looking into um, like whether it's focus groups or whether it's recentering who tells the story as well. So even when we're talking about, okay, we're going to do storytelling, but it's okay from whose perspective and who's telling it and how are we telling it and are we paying folks for telling the story and what are the different ways that we're doing it? I think, and there's also case studies and there's feasibilities. Like our email is here, so I'd be happy to geek out on this as well on like a case by case specific thing. I wish there was a like this is the way to do it, but it is very like I would say depending on the program. But that's the thing. I think a lot of times funders might say, "Oh, they're just giving us qualitative data. They're not giving us any quantitative data. How do we know this actually works?" Well, it's actually well, qualitative data has a lot of ways of validating it, and for it to be reach that level of caliber of science, there are actual methodologies that we can use that are validated, that are still empirical evidence, that still tell us that story, though, too, and don't undermine the people that we work with to tell this story.
Mhm. Yeah, let's geek out on that. I would be curious to hear more of your thoughts.
Happy to.
So I think that's it for now. In terms of questions, thanks you all so much for coming. Our emails are here if you have any other questions that come up, or if you're interested in seeing any of our the stuff that we talked about today, like the actual like reports and the meaning making stuff is all on the if you want to go through them in like depth. And just thank you all so much for coming in and asking and engaging with us. It means a lot.